in Africa region, we have an average of 100 emergencies every year. And increasingly, we see the overlap between conflicts, climate change-related disasters, and also our public health outbreaks.
So during COVID-19, we saw how the pandemic impacted many lives and livelihoods. In Singapore, we saw how many industry and private sector partners came forward as part of the pandemic response. And this is an important part of a city being resilient to an outbreak or a health emergency.
In Thailand, we think about in the rural area. Okay, because in the One Health is quite related to in the zoonotic disease or in the some disease that in the area that in the human and animal. But what we learn from here, we can see that One Health approach can be adopted and can be used as in the urban area as well. That's what we learn from the other countries.
Waiting and you feel you're ready to respond is not enough. You must predict with very high precision when certain outbreaks and public health emergencies are likely to happen. And this is where we applied the strategic tool for assessing risks developed by WHO to know when and what's likely to be the scope of any public health emergency.
This meeting was very important due to the urbanization we are doing and have a new tool and form it together and have an experience sharing and knowledge sharing with other countries like Singapore, Germany. It was great to have this and not have the knowledge not only from our region, the EMER region, but also internationally.
The key component for effective emergency preparedness in urban areas are the multi-sectoral coordination, cross-sectoral coordination between health and non-health sector.
So the existing tools predominantly focus on the national level and they do not adequately cover the local or the city dimension. So this was a World Health Assembly resolution that was adopted in 2022. And this resolution specifically
requests WHO to support countries in, among other things, strengthening capacities and capabilities in urban health emergency preparedness and response, and also implementation of the urban preparedness framework.
The added value of this meeting was that we moved a step ahead in order to further discuss what are the particular needed capacities which might be different in an urban area compared to a rural area.
Most importantly, 60% of that space that will exist in 2050 has yet to be built. So herein there's a huge opportunity for us to influence the way that infrastructure and services are provided in that future urban space.
National governments must work closely with regional and local authorities to develop comprehensive health emergency plans tailored to urban needs.
The world is urbanizing at an unprecedented rate. Whether it is the effect of climate change, natural hazards, or infectious disease outbreaks, we must ensure that our cities are adequately prepared to respond to a broad range of shocks.
And we hope to see a better prepared world and many cities that are able to be ready for the next pandemic or next health emergency.